to talk to you about the brow lift, or what we call as a forehead lift. So why do we do this surgery? Okay, as the name tells you, brow lift is just to lift the brows. So the rule is, if you feel the bony brow, that's a prominent part of the bone on your brows, on your forehead, and if your hairy brow is naturally below that level, then often you will require a brow lift. So that is repositioning the brow from a lower position and taking it up. So the important thing to consider is this. First of all, how low the brows are. Is there asymmetry in the brows? In other words, is one brow higher than the other? In which case it can be readjusted, but generally it doesn't work very well. And the third thing is the width of the brow. For example, if you have a wide brow and the height of the brow is high, if you do a brow lift using what we call as an endoscopic brow lift, where we make tiny cuts on the sort of hairline area and pull it backwards to lift the brows, your forehead becomes even longer. So we don't do an endoscopic brow lift in these situations. So when you have a wide brow, we would do a traditional brow lift where the cut is made all the way along the hairline. It is what we call as a pretracheal or trichophytic lift, and then remove some of the skin and then lift the brow up. So brow lift surgery in itself is very straightforward to do. However, the most important thing is this. Sometimes asymmetry of the brow is inevitable. If you have a pre-existing asymmetry, that generally doesn't go away with surgery, at least not completely. And the third thing is, often after brow lift surgery, you will notice some amount of numbness of the forehead and the brow, and certainly the scalp areas, and that sometimes can't be avoided. So overall, as a surgical procedure, it's a great procedure to reposition the brows. However, it needs to be done properly, and depending on what we are trying to achieve, there are different types of brow lift, and we have to tailor the brow lift to your individual needs. So obviously, during a consultation, we will be talking about all this in detail, and we'll be planning exactly what sort of brow lift you will need, and we'll be talking about the risks and benefits of all these procedures. Again, if you want to know more about it, either contact us or do book an appointment.